Dialysis definition. Dialysis is an artificial process that performs the functions of the kidneys when they fail. It removes waste products, excess fluid, and electrolytes from the blood. Hemodialysis definition. Blood is removed from the body, filtered through a dialysis machine, and returned to the patient. Frequency. Usually 3 to 4 times per week. Vascular access. Arteriovenous fistula preferred. Arteriovenous graft, central venous catheter, temporary. Pre-dialysis nursing assessment. Fluid assessment, measure body weight, compare with previous post-dialysis weight, check vital signs, assess edema, assess lung and heart sounds. Fistula assessment, feel thrill vibration, listen bruit, whooshing sound. Absent thrill or bruit, notify healthcare provider immediately. Medications to hold before hemodialysis. Hold medication that may cause hypotension, ACE inhibitors, ARBs, beta blockers, calcium channel blockers, diuretics, vasodilators, example nitroglycerin, also hold some antibiotics, penicillin, cephalosporins, digoxin, water-soluble vitamins, vitamin B, C, folic acid, usually continue calcium supplements, insulin if appropriate. Electrolyte priority. Hyperkalemia most important. Signs ECG changes, cardiac dysrhythmias, treatment IV calcium gluconate protects heart, IV regular insulin moves potassium into cells. Dialysis disequilibrium syndrome DDS cause rapid removal of solutes causing cerebral edema. Signs restlessness, confusion, headache, vomiting, nursing action, slow or stop dialysis, notify healthcare provider immediately. AV fistula care, teach patient to check thrill daily, squeeze a rubber ball to strengthen fistula, avoid BP measurement on fistula arm, no venipuncture on fistula arm, avoid tight clothing or jewelry, do not sleep on affected arm, avoid heavy lifting greater than 5 pounds. Monitor for infection, bleeding, pale skin, numbness or tingling, early signs of poor circulation. Peritoneal dialysis. Definition: dialysis solution is infused into the peritoneal cavity. The peritoneal membrane acts as the filter. Phases: fill, dwell, 30 minutes, drain. Pre-procedure nursing care. Record body weight, warm dialysis solution before infusion. Major complication: peritonitis, signs, fever, tachycardia, cloudy drainage. Prevention: strict sterile technique. Action: notify healthcare provider immediately. Respiratory distress, cause rapid infusion on or overfilling abdomen, signs dyspnea, tachypnea, crackles. Fast nursing action: raise the head of the bed, high fowlers. Poor dialysate outflow. Assess patient first, abdominal distension, constipation. Then assess equipment, catheter kinks, obstruction. Intervention: reposition patient side lying, do not flush catheter initially. Diet after dialysis: increase dietary protein because protein is lost during dialysis. Hemodialysis versus peritoneal dialysis. Feature: filter. In hemodialysis, dialysis machine. In peritoneal dialysis, peritoneal membrane. Feature: access. Hemodialysis, AV fistula or graft. Peritoneal dialysis, peritoneal catheter. Feature: location. Hemodialysis, dialysis center or home. Peritoneal dialysis, usually home. Feature: frequency. Hemodialysis 3 to 4 times per week. Peritoneal dialysis daily. Feature: major complication, hemodialysis, hypotension, DDS, peritoneal dialysis, peritonitis. Feature: priority assessment, hemodialysis, thrill and bruit, peritoneal dialysis, drainage appearance. Key nursing care: Hemodialysis protect fistula. Peritoneal dialysis maintains sterile technique. IL NCLEX or basic nursing exam points. Dialysis remove waste, excess fluid and electrolytes. Hyperkalemia is the most dangerous electrolyte imbalance in renal failure. Before hemodialysis, assess fluid status and AV fistula, thrill and breathe. Never measure blood pressure or perform venipuncture on the fistula arm. Restlessness during hemodialysis may indicate dialysis disequilibrium syndrome. Cloudy peritoneal drainage strongly suggests peritonitis. Always use strict aseptic technique during peritoneal dialysis. For respiratory distress during peritoneal dialysis, raise the head of the bed first. For poor peritoneal dialysis outflow, assess the patient first, then the catheter and reposition before flushing. Encourage high protein intake after dialysis.